and I'm a chiropractor. Today I'm here to introduce to you guys what happens in a chiropractic session. There are a lot to do during the first visit. Upon patient's arrival, vital signs such as blood pressure, weight, height, and consent are taken. Next, during history taking, multiple questions regarding of the complaint will be asked. Besides, patient's psychosocial history, family history, and system reviews will be asked too. This is to gauge patient's general health and active daily living that may relate to the problem. After history taking, a detailed physical examination will be carried out, which consists of postural assessment, range of motion, static and motion palpation, neurological assessment, and orthopedic tests. These steps are there to help chiropractors to spot the anatomical structures that are responsible for patient's complaint. After physical examination, further imaging such as X-ray, MRI, or blood tests may be ordered. Once everything is done, an explanation of patient's complaint is given together with patient's prognosis and a detailed treatment plan. The treatment plan may consist of a few elements. For example, chiropractic adjustment, modalities such as ultrasound and shockwave therapy, home exercises, nutritional advice, and soft tissue therapy.
Good evening, everyone. Welcome to the fifth day of the ACM World Spine Day 2021 webinar fitness and wellness program in store for you all. The World Spine Day 2021 virtual challenge is happening now until 16 October 2021. Join now and finish the challenge for a chance to win amazing prizes. This World Spine Day let us all commit to being kind to our spine, reactive, and get back to back. How to join? Download the BookDoc app for free from Apple App Store or Google Play Store. Register your account, sync your fitness tracker, verify your phone number, join the virtual challenge for free or paid entry. Today's session is brought to you by the Association of Chiropractic Malaysia, sponsored by Evo Performance, and in collaboration with Kim Chiropractic Spine and Physiotherapy Center. Today's topic is 5 ways you can manage MCO pain, and our special guest is from Kim's Chiropractic Spine and Physiotherapy Center, Dr. Kimberley Looi. Dr. Kim is the founder of Kim Chiropractic. She completed her studies in the New Zealand College of Chiropractic. Since 2013, she has been caring for patients in the Klang Valley and believes chiropractic care should be common. If you have any question, feel free to drop your question in the comment box. Let's welcome Dr. Kim. Hi, Dr. Kim.
Hi, everyone.
Okay, so the floor is yours.
Hi.
Hi.
Okay, thank you. Okay, hi, I'm Dr. Kim. I'm the founder of Kim's Chiropractic, and I'm here to talk about 5 ways you can manage MCO pain. Okay, next slide, please. Okay, instead of talking about general pain, I want to address the common MCO complaints in more detail. I hope everyone is doing well despite the current pandemic, but typically you would get more complaints such as aches and pains, aches usually in the muscle area of your neck and shoulder, your lower back, and also pains in your joints of the spine, mainly in also the neck, mid back, and your lower back, wrist, and foot pain. So this is because we are less active nowadays, and we have more working hours at home sitting down. So this can also cause something new, like numbness and tingling, or it might have always been there but worsened. And also because of the pains in your joints, you can have stiffness as well. And because of all this, you can have poor sleep uh, because of your pains, or your numbness and tingling, or even your stiffness. And because of poor sleep, you can feel more tired and lethargic. Next slide, please. So, what you can do for all these complaints is the following. And because one major cause of misalignments are due to all the pressure that you've been getting, they cause all these complaints. So misalignments are when segments of your spine go out of place. And this can cause a range of problems, such as nerve impingement, pulling on your muscles, decreased movement of your spine and joints, and then this in turn will cause stiffness. So the nerve impingement can cause you pain, numbness and tingling, and also affect your sleep. So other than that, the pulling on the muscles will cause your muscles to ache. So as chiropractors, we find these misalignments in your spine and joints, and we correct them. And this is done mainly with our hands, as you can see in the photo. And this will reduce the pressure on your joints and your nerves, and thereby improving your pain and your aches. And then also it will reduce the joint stiffness. Once your joints are properly aligned, they can move properly again. And because the nerves in your neck go into your head, the correction of the misalignments in your neck can improve your sleep as well. And if you have less pain and less aches, less stiffness, your sleep will improve as well. And then you can heal and recover. Next slide, please. So physiotherapy goes hand in hand with chiropractic because your muscles connect to your joints, and a lot of them connect to your spine. So physiotherapists focus and specialize in your muscles, tendons, and ligaments. So what they will do usually is that they will release your muscle tension. They will stretch your muscles and strengthen your muscles and joints. This will improve your posture and overall improve your function as well. So when it comes to any aches, especially in your muscle or any muscle tension, you will benefit greatly from physiotherapy, apart from chiropractic. And also the stretches and strengthening exercises will be taught to you so that you can continue to do this at home, because the treatment is only for half an hour to an hour at the center. But once you go home, you will start to do your own daily routine. And if you don't take care of yourself, then the pain will be slow to recover, and also the effect of the treatment won't be so long term. So everything that we do at the clinic and we teach you is to recover you for a longer term, and also as fast as possible. So that's why at Kim's Chiropractic, we usually combine these two treatments for most patients. Next slide, please. Okay, so now I will show you a demo of home stretches that you can do while sitting down. The one that requires you to lie down. I won't demo, but then it's pretty easy to do, and I will give you some guidelines on how to do it. So the first one that I like to do that is very effective for neck pain or neck stiffness is there's two that I like to do. One is for the front of your neck and a bit of the side, and the other one is for the back of your neck and a bit of the side as well. So the first one, you just hold your collarbone on one side, okay, and then you using your fingertips and not your fingernails to dig in. So you're just holding it firmly. You look up, and then you turn away from your head, this hand, okay, as far as you can go. So this is held for 30 seconds, and then you come back to neutral slowly and gently. So you do this on both sides, okay, for 30 seconds. And then the second one for the back of your neck, you use your hand to pull your head to the side and then downwards as far as you can go, okay? And then if you want more stretch down to your shoulder, hold the side of your chair, the bottom part of your chair, lean away, and you will feel it go all the way down to your shoulder. So this is mainly for the neck muscles. Make sure you're sitting up straight, and then when you are tilting your head, make sure you're looking forward and only look down when you pull your head down. So this ensures that you're stretching the correct muscles. And this other stretch that I like to do for the mid back, it's called the eagle pose. You can do it sitting down as well as on a chair or on the floor. So basically what you do is you put one elbow on the other elbow, and then you twist your hand around until your palms are touching together, okay? So just make sure that your upper arm is parallel to the floor, and then you're looking forward, okay? And you're stretching only this one side here. So do it on the other side by placing the other elbow on top and then touching your palms together. So hold this also for 30 seconds, and you will find that it's very helpful in relieving any aches and stiffness. And the one for your lower back requires you to lie on the floor with a yoga mat, preferably, so that it's not so hard on your spine. You just basically bring your knees towards your chest, as close as you can see in the photo, and you hold for a minute. And then after a minute, you just slowly release. And then what you can do in this position as well is you can roll from side to side. So hug your knees in and you roll your whole body from side to side. Okay, try to balance and not tip over, but this will really stretch your lower back spine and also a bit of your glutes. So this will release a lot of tension that you get from sitting down. And you can do it for about a minute, both the stretch and the roll. Next slide, please. Okay, so this is mainly for people who are working from home. A lot of my patients do. So it is a very good thing to practice to adjust your workstation. So you don't have to do all of this at once, and this is a general guideline to help improve your posture when you're working, and also reduce the pressure when you're sitting down for long hours. And then you can prevent your complaints, your pain from getting worse, and also improve it. But it's best to do this with your stretches and exercises. So what you can do is the first thing is to make sure your shoulders are relaxed. Okay, this is something that is a habit and a lot of people find hard to do. But once you realize that your shoulders, when you're working and you're hunching over your computer, you find that you're very tense and you're very stressed. So make sure that you lean back and your shoulders are relaxed. And if you adjust your arms to be parallel to the floor, then you don't have to crouch over your keyboard, or if it's too high, and if it's too low, then you are also not tensing to compensate for the uneven level of your keyboard. And if you have an arm support, like if your chair has an arm support, then it'll make things easier. Then your chair, if you are sitting on a stool, there's no support. So if you have a work chair or invest in one, that'll be the best. So make sure that it has a backrest, and that will support your lower back, but you have to be leaning back and touching, your back should be touching the chair in order for it to support. Okay, and then your screen should be at eye level. So if you can use some books, or if you have like a box, or you have a laptop stand, you prop it up so that you are not looking down or looking up too high, because that will strain your neck and also strain your eyes. And then when your chair level is adjusted, it should be so that your thighs are completely on the chair, and also that your knees, your legs should be bent in 90-degree angle, preferably, and your feet it's flat on the floor. So usually chairs are adjustable and tables are not. So make sure that you get one that can be adjusted, because all tables like will differ in level and it's a bit harder to adjust. Okay, next slide, please. Okay, so for those who don't mind to invest in some technology that you can do at home, this is something that we use at our clinics as well. It's called the Evo 3-in-1 Electrotherapy Machine. So basically, I have one here with me, and it's pretty easy to use. So basically, what we use it for is we use it to support the recovery process during our treatments, because it basically speeds it up. And how it works, it delivers electrical pulses that imitate your brain signals. So this 3-in-1 has 3 settings basically.
Okay. Sorry for the technical error. So please wait for us. Let us invite back Dr. Kim. Yeah. So yeah. Hi, Dr. Kim.
Back on?
Yeah. Back. Yeah. There's some technical error, I think. Yeah. Okay.
Okay. All right. So I was halfway explaining how to use the machine. So it's pretty simple. You take the pads that it comes with from the plastic, and then you just stick it on the area that you are feeling the pain. So I'll demo it on my arm. So over here, don't worry, it comes with instructions on where to place these pads. And also you want to make sure your skin is dry and clean. So make sure that you wash that area so that the pads last longer, or you can use an alcohol swab to get rid of any oils or any dirt before you stick these on. So I'm going to just stick it here, okay, like this, just to demo. So you just turn it on by long pressing the power button, okay, and then there's 3 different modes, which is the TENS, EMS, and massage. I'll explain what each of these does. So the first one, TENS, is the most commonly used at our center because it will give pain relief quite easily. Okay, and then it will be selected first. So you can choose the programs as well. I don't think you can see, but basically there are 3 programs that 2 are preset and 1 is customized. So you can just choose either one, feel which one suits you best, and just let it run on its own. It's usually for 30 minutes. So I'm gonna just select the arm area. So the body part, you can choose like neck, shoulder, arm, hand, back, abdomen, hip, leg, foot. So it covers quite a lot of areas. So I'm going to choose the arm one. And then basically, there are 2 channels, but I'm going to use only 1 channel. So this first channel, I'm going to choose the first program. And then basically to start, you press the plus button. So this plus and minus is basically to adjust the intensity. So I have this machine is pretty strong. So I have a low tolerance. So I only will go up to 2. So I'm not sure you can see. My arm is moving because it's pretty strong. So basically what it does, it contracts your muscles, and basically the tense mode is it targets your nerves with the electrical impulses, and then it will block the pain signals from going to your spine and your brain. So that's how it works. And then it also will boost your production of endorphins, which are a natural pain reliever. Okay, and if you want to stop, you just press the power button, and then it stops. Okay, and then just turn it off. So it's a really easy to use machine, and it's quite effective in pain relieving. So once you're done, just take them off and then stick it back onto the plastic. Okay. So apart from that, because it has 3 modes, the EMS mode is mainly to maintain or regain your muscle strength, and you might find that your muscles have weakened due to lack of use, the constant sitting down or inability to go out will definitely reduce the use of your muscles. So it's typically better to do that every day or an alternate day to see the effects of that. But it's just good to have if you have no time to exercise, or if you want to speed up the muscles being built with exercise, you can use this machine to do that as well. And because when you want to increase muscle strength and build your muscles, the muscle has to contract. So this one will make your muscle contract repeatedly without you doing anything. And with that contraction, you will also have increase of blood circulation. So the tense mode, like I explained, is more of a pain reliever, and it also relaxes your muscle spasms. The massage one is mainly for relaxation. So it does feel like someone is massaging you, but they're using electrical impulses to do that. So there are benefits in investing in some technology to help with your pain. And you can find this machine on their website. You can just Google Evo Performance, and then you can contact them through there if you are interested in getting one of these for home use. And you also can share it with your family. It really does help in pain relief, and it will recover your condition faster. So if you want a more personalized and more in-depth knowledge of your problem or your pain, next slide please. You can come by one of our clinics in either Taman C or Katamas, where we can consult you and physically assess you. We are doing a free consult and assessment at the moment. So there's no commitment, and at least you can know your problem and how we can help you. Next slide, please. And these This is our contact. You can check us out on Facebook or Instagram at Kim's Chiropractic. And you can either WhatsApp us or give us a call at any of our 2 branches. And we are usually faster at responding with WhatsApp or calls. So do come by, and we can help you sort out any pain that you might feeling, even if it's like not due to MCO, but something that you've been having for a while. So that's all from me. Thank you very much for tuning into my talk. Now I'll be accepting any questions.
Okay, so thank you, Dr. Kim, for such fruitful sessions. And please feel free to drop your question in the comment box and we'll go through them. Okay, so Dr. Kim, from your presentation, there's a few questions that came in. Was that you mentioned about the sitting when work from home, right? There's any particular duration is recommended that we can sit in front of computer before we need to stand up and do some of the home exercise that you show us and all those.
Okay, so for those that sit for long hours, I know it's very hard to remember to get up every once in a while. So a good guideline is every 1 to 2 hours, because typically you need to like either go to the toilet or take water or have lunch, So use that as an opportunity to get up from your seat, and you can set an alarm for that. Put your water a bit farther away, and then you have to get up to get it. And usually 2 hours maximum should be the sitting duration for me. Any longer than that, that will cause quite a lot of pressure to build up in the lower back.
Yeah, so that's good. So just a reminder, 1 to maximum 2 hours that is recommended for you to stand up and just move a little bit so that you won't put too much stress on your body in one position.
Yeah, you can either do like a stretch in between, or you just stand up and then like move around a little bit. It's better than just sitting for like 3-4 hours, which is something that I notice a lot of people do because they're so focused on their work. So at least 1 to 2 hours, at least you are still productive in your work, but at the same time you are being kind to your spine.
Okay, so just go back a little bit on the pain and all those. So just curious, when do it's time to seek help, or when we can manage on our own with the home exercise and all those things? Yeah, any particular like checklist or indication for us?
So usually, once you start feeling pain, it's already a warning sign that your body is having a problem. So usually people won't know until they feel it. So once you get the pain, just know that it's already been building up for a long time already, and I'm talking in terms of years. So once you're starting to get the pain, it tells you that there's something wrong. So that's when you should already seek professional help. But if you are worried of leaving your house, that's why I gave you some home stretches to do, because that is how you can help yourself at the moment if you're not you don't feel comfortable with leaving your house yet to see a physio or a chiropractor physically. So but once you really have the pain, you already have to seek professional help lah, in order for the pain not to get worse, and also to recover faster lah, if you sort of treat the problem early.
I think just to put a little bit more in what Dr. Kim mentioned, that the pain is like alarm system. So some people think that pain is normal, but like what Dr. Kim mentioned, that pain is something you need to take notice and get help if it persists as well. So I mean, Dr. Kim, just now you mentioned about the home electric therapy, right? How often can we use it? Like if the patient purchase, then and is it they can put on themselves? Is it properly placed and the position of the electropad and all those things?
Okay, I explained before. Let me just show you. So it comes with instructions
sort of like instructions on like where the body part is, and also like the treatment time, and what kind of pulsing it's doing. It's a lot, so it's probably not necessary, but if you would like to know, they have all the information here. And then also, if it's to do with like the body parts, they do have like a diagram to show you where to place it. So you can just follow this lah, and it's quite safe to use. Just start with a low level first, because it will increase. It can increase like a lot of levels. So you just start with level 1, see how you feel, and typically you can use it daily. But of course, if there are days that are more painful, you can just put it on, and if you are your purpose is to regain the muscle strength or retain the muscle strength, you can use it daily or every alternate day.
Okay. So maybe alternate days. So like Dr. Kim mentioned, I think for this particular Evo brand, they have pictures and also guidelines for you to use. Of course, when there's any questions, you can seek with your chiropractors or your physios what to help and how to work around with the machine that you purchased as well.
Yeah,
And
because
Dr. Kim,
Common machine, so we can help you to sort of like set it up or like teach you how to use it. And I'm sure the guys at Evo Performance also will help you in it, because you will be contacting them directly if you're interested.
And Dr. Kim, I mean, just curious, nowadays the market is very, a lot in the market that someone would wear during their sitting in front of computer. I mean, any recommendation, is it comment on those devices that people would wear to pull their back? And yeah.
Okay, surprisingly, I get asked this a lot because nowadays you see it all over Lazada or Shopee, But for me personally, I don't feel like these devices help in the long term. You might feel like you're straighter, and it does pull you back, but because these devices will your body will depend on these devices if you are wearing it for long term. So it will weaken your own body, and you will depend on the device. And then in the long term, that's not so good lah. Because are you going to wear it forever? So usually I would suggest it short term. Maybe it's just to get you into the habit of straightening your spine a bit more, improve your posture. And I think it's 21 days for you to develop a good habit. So maybe it's more worth it to try shorter term, but I wouldn't recommend relying on it like for months or years.
Yeah. So like Dr. Kim said, do not depend or rely on the devices, although so it's better to build on your muscle to maintain your good posture. Okay, and like Dr. Kim mentioned, also is out on our Facebook saying that 21 days to build a habit. So take micro breaks in between your work and drink water. Build out your habit in these 21 days as well. Okay.
Yeah.
Okay, let me see any other questions.
And honestly, nowadays there are lots of technology that can help us with reminding. So I wear a watch that reminds me to stand up every hour, and but my job doesn't require me to sit long hours. But it's good, like if I'm watching TV at home or like somewhere I'm sitting for long hours, it reminds me. So I'm like, okay, I've been sitting for too long. So it helps as well. Otherwise, you can use your phone to set an alarm.
Okay. So another question came in that when patient or when anyone feel any pain after sitting for long, and do they apply heat pack or ice pack for that particular pain that they are experiencing?
Okay, so we only will recommend heat pack according to the updated research and This is also very in line with physiotherapy ways of icing and heat pack. So we only use ice if there's very obvious swelling and if the injury is fresh. So if you're feeling any pain that's not caused by injury or nothing that is like very hot to touch and red, we will usually recommend heat pack. So like for example, neck pain and back pain, we would recommend heat pack for about 10 to 15 minutes. And of course, if the heat pack has cooled down, then you can take it off. But usually ice, we don't want to overdo it because it will cause your blood vessels to sort of like shrink and slow down the healing. So we won't recommend that lah. Especially if you've not seen anyone professionally, I don't recommend that you just ice on your own. But a good guideline is that if it's not hot or red, you can put a hot pack for 10 to 15 minutes.
So if you experience some muscle pain after sitting for a while, so you can use some heat pack. But if you experience any particular swelling or a fresh injury, and also most likely ice would help, and seek for professional care on that particular cases. Okay, so let me check any other questions that came in. So Dr. King, any take-home message for the viewer over here that they need to take care of during this MCO period? I believe a lot of people start going back to their office, and switching back from work from home to office work from home. Any particular things that they need to take note of?
Yes, definitely, because even though MCO pain is like a very real thing now, people have been having pain even before MCO because especially those that work at their desk, they still sit long hours. It's just that MCO is worse because of the workstation and longer hours of sitting. So all this can be applied to those that are going back to the office, like standing up and also doing stretches, and actually a lot of our advice focuses on increasing your activity so that your muscles don't weaken, your joints don't get into so much pressure, causing all these complaints, pains, and aches and all that. So definitely you have to start increasing your activity. Walking is not considered because anybody can do that, even a 90-year-old can do that. So you have to firstly seek professional help if you are not sure what to do first. But you have to start doing exercise. You can start with the home exercises that I give you. It's a great way to start because it's very safe and it's also very effective. I do them myself. So you can start with that, and then start to incorporate more activity that requires you to like exercise and like go out and do like maybe jogging, or you can do like cycling and things like that. So that will definitely reduce complaints and also help you lead a healthier lifestyle.
Yeah, so that's a very good advice. Stay active regardless you're in office or work from home. Stay active with home care exercise, or even some leisure exercise like Dr. Kim mentioned. Jogging, cycling would be a good option to stay active. There's one more question that came in, that how often are the people recommended to see a chiro or a physio when they experience pain or in this situation or MCO?
Okay, that's a great question, because for at Kim's Chiropractic, because we combine both chiro and physio, we tend to see faster improvement. So if it's a very mild to medium case, we will only require them to come once a week. because we also want to rely on the body's healing and recovery, and that takes time. So usually for us it's once a week. If it's very severe, then up to 2-3 times a week. But majority will come once a week for around 6 weeks, and then after that we will see significant improvement, and then we go on to more maintenance once or twice a month. Once a month or twice, once in 2 months. So that is when they are not having much issues anymore, and they are just coming in for a follow-up. But typically, you would expect most places to require weekly treatments in the beginning to see results.
Okay, so basically, like Dr. Kim mentioned, it will be varies depends on the condition. So more serious, it will be more often or more frequent. If it's more mild and moderate, then it depends on the intensity as well. So I mean, there's another question: when they recover, do they still need to come in? Like, is it forever thing that they need to come to chiropractic care, or is it anything that they can do that could slowly phase off?
Okay, so chiropractic is chiropractic's goal is to actually prevent pain and all these symptoms and complaints. So maintaining is more important because that is longer term. And if you do, then there will be less problems in the future, and it will also prevent your pain from coming back as well. So you can like it with eating healthy. Like, you want to, how long do you want to stay healthy by eating healthy? You know, a few months only, like going on a crash diet, or is it like as long as you want to keep healthy, like, you know, something that you can sustainably do for many years until you feel like, I don't want to be healthy anymore. So same with chiropractic. You know, if you want to take care of your spine, if you want to keep your spine in a good condition, then you maintain it, continue to maintain it. So as long as you want to stay healthy and keep in a good condition.
I think it's a very good advice. Stay healthy to maintain, and regardless you have pain or no, chiropractic care can help you one way or another, and it will also determine the frequency of the treatment, as if you are coming in as a wellness patient as well. Yeah. I think there's no further questions from the audience. So yeah. So once again, thank you, Dr. Kim, for sharing such a wonderful information to us and our audience. And we also, yeah,
It's my pleasure.
yeah. So we also thank you for all our audience listen to today's session. Do remember to join the World Spine Day Virtual Challenge happening now until 16 October. And we also want to thank you, Evo Performance, as well. So they have sponsored the session today, and they also sponsor electric therapy that Dr. Kim showed just now as a lucky draw gift. If you participate in this virtual challenge as a paid entry, and you are entitled for the lucky draw. So do feel free to join the virtual challenge of either a free entry or paid entry for different lucky draw prizes, and stay active. So just for your information, tomorrow we'll be having the scoliosis health webinar at 8:30 on our Facebook Live as well. Thank you very much. Take care and stay safe.
Thank you. Bye.
Bye.